I think we will come back to it. But I really just want to start by thanking you, thanking Ronan, thanking all the participants for being here. This topic is so important. It's such a sort of remarkable period in the history of the world and the history of cities, and it's wonderful to have this conversation. I want to start. It's also wonderful to be on this call with three urban economists, all of whom I admire deeply. I want to start with this picture of death rates in New York City over the past 200 years. And the reason why I'm putting this up is it's really crucial that we start our grasp of COVID in cities by recognizing how unusual the past century has been. For almost all of human history, cities have been more or less killing fields. Right? Contagion spread along the nodes of the global transportation network. According to Thucydides, it came out of Ethiopia into Egypt and then struck Athens in 430 BCE. And then, of course, it spreads within cities. And as Diego has just shown us, it spreads also to those cities that are connected to the large cities that are the nodes. We have remarkably had a century of urban health. Right? And whereas a boy born in 1900 in New York City could expect to live 3 years less than the national average, could expect to live 6 years less than the national average in 1900. Today, life expectancies are more than 2 years longer in New York than elsewhere, at least until COVID-19 hit. This did not happen easily. As you can see, the great pandemic that was killing in 19th century American cities was cholera, which is a waterborne plague. And American cities only became safe because they spent as much on water and sanitation as the national government spent on everything except for the post office and the army. Now, the COVID shock, of course, is a health shock that is then turned into an incredible economic dislocation, right? We have in the US, and that's true in many other places as well, the highest unemployment rate we've seen since essentially the Great Depression. And the reason for that is that we've seen a transition of people who have worked, increasingly in occupations that are deeply vulnerable to a person-to-person pandemic, deeply vulnerable to any fears about interpersonal physical connection. So there's this arc of employment from farms to factories to urban service workers. And those urban service workers are exactly on the front lines of this. In some sense, if you sort of think about it, our human ability to bring pleasure to people who are around us, to serve a latte or a cappuccino with a smile and thereby find employment, was both the one safe haven to robots, to mechanization, the one place where less skilled workers throughout the world could find a job, and yet it has placed them exactly in the most vulnerable position possible. This just shows the path of employment in the major sectors across the United States over the past 20 years. The blue line that you can see that's dropping, of course, is manufacturing. America still does plenty of manufacturing, but it's done largely with machines. It's done with deep capital intensive enterprises, and they by and large are relatively non-urban in the 21st century, in part because they tend to be very space intensive, where Henry Ford used only 20 square meters per worker in 1920 to have his workers in his factories. Today, it's quite common to have 200 square meters per worker in a heavy goods manufacturing plant. The line that is orange is the economic engine, the export service engine of cities, and that's professional and business services. So these are lawyers and accountants, financial activities are closely related. These are occupations which traffic in knowledge, and many of them can continue going even though there's COVID, maybe less effectively certainly, but their jobs are still there. They're teaching, they're doing webinars, they're connecting through the internet. The big green line that's rising are education and health service workers. These ones are tied down by the government, and these jobs are pretty safe from economic dislocation, although many of them are also on the front lines for transmission of disease. It's the two lines in the middle, the third and fourth lines, that I want you to look at. They're growing. One is retail trade, that's the flatter one. The other one is yellow, that's leisure and hospitality. Together, those lines make up 1/5 of American employment, or 32 million American workers. And those are the jobs that are most at risk. And in some sense, if I have any optimism that comes out of this, it is that share of America is so large that I cannot imagine that we will ever take the level of risks that we have in the past 15 years. And the size of that vulnerable block makes me at least modestly optimistic that we will actually take future pandemics seriously and make the investments that we need to reduce future risk. Before COVID-19, I was deeply anxious, and I still am, about this graph, which shows the geography of not working among prime-age males in America. And as you can see, right, the really big numbers are in this eastern heartland of the US. It's relatively non-urban. It starts down in Louisiana and Mississippi and runs up through Appalachia into the Rust Belt towns of the north. These were cities that didn't have professional and business services. Their employment is dominated by healthcare, by a government-funded sector. And so they didn't have the secondary dollars which moved to leisure and hospitality. So I previously was terrified that this group would never find employment, whereas I was more optimistic about cities. If we don't fix pandemic, that may be reversed, or at least the urban advantage may entirely disappear. Now, the question on the table is, will COVID-19 make the world less urban? And I think I share the view that Martina articulated at the beginning, which is that if pandemic persists, then surely the answer is yes. If this happens every 4 or 5 years, then I cannot imagine a world in which we will not seriously consider relocating significant amounts of activities. Less so perhaps in the developing world, right? Poorer places, New York continued to urbanize in the 19th century despite the cholera epidemics because cities were poor. That will continue to happen in the poor world as well. But if this persists, then we will have a less urban world. I think that's helps make the strong case for investing enough and hopefully getting lucky enough so that this will be a rare one-off event and it will have no permanent impact, at least on the health consequences. But even then, there are questions about whether or not cities will recover. And I should say that history is notably unclear about this, right? So if you think about the plague of Justinian, stops that emperor's attempt to rebuild a Pax Romana in the Mediterranean world in the 6th century. And essentially the appearance and reappearance of the Black Death, which is what that was, essentially kept Europe far less urban for a millennium. By contrast, the influenza epidemic of 1919, right, came and went, killed millions, but essentially the urbanization of the world continued. So we can't, think that we know what will happen. But part of the difference is that the Black Death kept on coming back and back, and the influenza pandemic ended. Cities do bring, as Diego has already said, huge.
Ed, you're just breaking up there. I think. Let's see. Let's see for a moment whether he reconnects. Okay, maybe this is a good moment to see. Let's see whether we have any question we can talk about in the meantime until Ed reconnects. Diego, maybe we can ask you before you need to leave for your meeting. How has the work that you've been doing with the government shifted your perspective? Has there been certain aspects as an urban economist that have changed your views now, looking at this through the lens of the government?
I think one of the things that I've seen is actually, there have been people thinking about this possibility for a long time, right? So this committee advising the government, most people actually are doctors, epidemiologists, biologists, and what for most of us is not something we have thought about. Somehow they have been seeing it coming for a while, right? But they also know a lot precisely because of that about this, right? So certainly, we've come to realize this a bit too late. Certainly, this should actually at least provide a focus for keeping investing in science and especially for doing policy and politics in a way that's science-based. I think this has made it clear how important that is, right?
And we've talked about investments now in several places. What do you think are some of the key investments that cities are in the process of making or need to make to be more resilient towards pandemics in the future?
Yes, so partly what we were discussing about commuting and public transport, certainly adapting it to to being able to use it in a time where the virus and the possibility of contagion is widespread, but also thinking of more fragile places, right? So one thing we've seen almost everywhere is that nursing homes have been responsible for a huge percentage of deaths in many places. In many places, up to 50–60% of the deaths are in nursing homes, right? And this is something that we realized too late, right? We should have protected these places for very early on. And of course, we didn't realize this. This is not something that one place got wrong. Almost every place got this wrong. But certainly, we've seen that nursing homes are very fragile. First responders, health workers are also in very delicate positions, right? So there are very localized investments in certain sectors and certain activities that we need to make in terms of protective measures, but also in terms of preparation of being able to react quickly, right? So since it is something that is probably going to go away gradually and in waves, and we're going to see more of this, I think certainly we need to be prepared for that. I think we have Ed back online.
Yeah,
okay, great.
I am sorry about that. It was a mysterious outing of the internet, reminding of the importance of investing more broadband in rural areas. I think that's the that's the takeaway here. Okay, so I was just trying to share a little bit from the Alignable survey, and I'll go quickly. And again, I apologize for that, but the ways of technology are often quite mysterious to me. Okay. Current slide. The Alignable survey is business. We had 7,500 respondents. They're by and large small firms, so this is not representative of the US as a whole, but it is representative of the share of the economy that employs 48% of American workers are in these firms with less than 500 workers. This is the representation across the country, which is fairly good. What I can tell you is that the closure rates were extraordinary even by April 1st. So over our whole sample, 45% of firms had closed down, 62% in tourism and lodging, 54% in restaurants. The businesses that were particularly in the New York metropolitan area or around there were even higher. So just an enormous amount of dislocation. And as opposed to sort of large scale employers, this is a very vulnerable cluster. This is a cluster without a lot of cash, and many of them, and you can see this in the next column, have no expectation, think it's quite possible that they're going to be closed in December as well. We engaged in a little bit of a sort of hypothetical experiment. We sort of varied their prompt on thinking about how long the crisis would last, and by changing it from 1 month to 4 months to 6 months. And for example, only 30% of the restaurants in our sample thought that they would survive at all if the crisis lasts for 4 months. That drops to 15% if the crisis lasts for 6 months. And the typical firm who has more than $10,000 a month in expenses had less than 2 weeks worth of cash on hand. So this is a very undercapitalized group. America's extraordinary lending programs may have done something to preserve them, but it's very hard to know if the $650 billion was being spent well. Just in terms of understanding the size, if this amount goes down, so if the crisis lasts for 4 months, based on our projections, we will have 32 million unemployed Americans just due to these small firms shutting down in December. So presumably many of them will come back, but the level of sort of economic Armageddon suggested by these numbers is just absolutely enormous. And I will say that I just wanted to agree with something that Diego said earlier. I have often been a critic of things like universal basic income, partially because I worry so much about not inducing people to stay at home, making sure we have good incentives to work. We shouldn't worry about that at all now, right? We're happy with having people not working. That's entirely right. And so unconditional cash transfers during this period are entirely appropriate. Next thing about remote working. We also tried to figure out how many of these firms in the Alignable survey were working from home. We showed this across industries, and we related this to some work that Dingle and Neyman did trying to estimate the possibility of working from home. Many of you may have seen the Dingle and Neyman work. It fits remarkably well, and that's what you're seeing here. This is the prediction pre-crisis of Dingle and Neyman on how likely we are to see people being able to convert to remote work. And the answer is that predicts extraordinarily well which sectors, at least in our data, have transitioned to remote work. This now shows a different survey of the National Association of Business Economists, where we asked, how many of you think that this transition to remote work will be permanent? In this case, the Dingle and Neyman work also predicts what share think that they'll be permanent. I'll just show you this, which gives you the sense of how big these numbers are in terms of the transition in terms of ex-post working. So we asked what share of the firm's workers who did not work remotely before COVID-19 will do so once business returns to normal. And 36% said a fairly small number, but another solid 30% said that more than 40% of them would start working from home. Now, I agree with what Diego said, that for many jobs, you will still have robust demand for business centers. You will have robust demand for high densities at the high end. And it's exactly these issues about unplanned interaction, about young workers learning and becoming skilled by being involved in this cluster. But there are many more routine knowledge work tasks that can be put out and can be put to different locations. And I think because of that, almost assuredly, the next 3 to 5 years are going to be a very tough one for anyone who is interested in commercial real estate downtown. Last point I want to make, public transportation. So it seems certainly natural to believe that high density public transportation would spread the disease. It's very hard to know how big that effect is, at least with the American data. Diego's data, which is vastly better, may enable you to know this, but I want to just present three facts which should make it clear about how difficult the normal methods we have are for identifying this. So first, we have the positive COVID test rate per 1,000 across New York City zip codes. This is now regressed on the relationship between the share of workers that use public transportation, and as you can see, it is starkly negative. Okay, there's no sense if you look at this data and you say, boy, the high public transit usage areas are the ones that we were hit with high COVID tests. Now, this is the share of people who are going to emergency rooms for respiratory or flu-like symptoms and public transit usage. And this one is strikingly positive, okay? So you've got these two pieces of data and they show exactly the opposite conclusion. And I think it's very hard to interpret what the reality is here without actual true randomized testing. I should also suggest that this is something that's evolving over time. But Diego made it clear that there are many ways in which you could imagine that public transit would not be that risky for you if handled appropriately. And of course, densities have become very low in New York public transit stops since the COVID crisis started. But the last thing, and to me at least, the most obvious mistake that we've made in handling COVID in the United States is our failure to protect the nursing homes. And there also appears to be a link with public transit here. And here we can use the death data, which is less likely to suffer from many of these biases. This comes from work of a graduate student of mine, Karen Shen. And this is showing the share of nursing homes with an outbreak or the share of nursing homes with deaths and the proximity to public transit of this nursing home. And the nursing homes across the US, where 60% of the deaths in Massachusetts from COVID-19 have been in nursing homes. This is highly related to sort of urban density. And so, cities may be able to be made healthy for younger people easily or reasonably easily. The old and the vulnerable are clearly the highest risk, and we clearly did far too little to protect them during this crisis. So I want to end with the same sort of optimistic view that Diego evinced, right? I believe that cities will come back. The human capacity to gain, to benefit from interaction with other human beings is fantastic. And I think for many of us, Zoom is not a perfect replica for being in person, which you just experienced right now when my Zoom went out, right? But I don't think that happens freely. Pandemic has destroyed urban civilizations in the past. And we really need to take seriously the issue of stopping pandemics before they spread, having a global monitoring system, making sure that we have a health system in place that can actually protect people in a proper way, preemptive vaccine investigation, better work on virology to get on basic questions like the nature of the viral load and the spread of the disease, and as well as investing in core things which would make urban health to begin with more resilient. And let me sort of end with that. But my point about cities and inequality, which I guess I should say something on the last of, is that cities attract poor and rich people. The fact that cities attract poor and rich people is not something that cities should apologize for. And suburbs should never be proud of the fact that they make it impossible for poor people to come there. But that being said, the presence of so many poor people in a highly dense environment is does create vulnerabilities, and it creates an obligation for cities to invest in the things that will protect that population from the demons of density like contagion.